Medical Assistant Exam Law and Ethics Questions. Question 1. Before the visit continues in a phlebotomy station, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A. Excessive thirst. Option B. Painful or difficult urination. Option C. Difficulty swallowing. Option D. Ear inflammation. The correct answer is option B. Painful or difficult urination. Dysuria refers to pain or difficulty with urination. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Ear inflammation is otitis. Question 2. Before the visit continues in a telephone triage workflow, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The tip of the index finger. Option B. The little finger near the bone. Option C. The side of the middle or ring finger pad. Option D. The center of the thumb pad. The correct answer is option C. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The index finger is commonly used for touch and may be more sensitive or calloused. The little finger has less tissue over bone and is usually avoided. The thumb is often calloused and has a pulse, making it less preferred. Question 3. When a patient encounter unfolds in a family practice clinic, a provider orders spirometry in the office. Which patient action is required? Option A. Talk continuously during the maneuver. Option B. Follow instructions for a strong, complete breathing maneuver. Option C. Remove the mouthpiece before starting. Option D. Hold both nostrils and refuse to exhale. The correct answer is option B. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Question 4. Given the workflow in an urgent care office, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Leave another patient's results for comparison. Option B. Describe the diagnosis in detail on the message. Option C. Demand payment details with full medical history. Option D. Leave limited information and a callback number. The correct answer is option D. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Sharing another patient's information is a privacy breach. Detailed clinical information may be heard by unauthorized people. Excessive information violates privacy and may not be necessary. Question 5. The care team in a certification exam scenario asks for guidance because blood spills on an exam room floor. Which response follows standard safety practice? Option A. Cover the spill with an exam table paper. Option B. Wipe the spill with a dry paper towel only. Option C. Ask a patient to avoid stepping on it. Option D. Use appropriate personal protective equipment and an approved disinfectant. The correct answer is option D. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Covering a spill does not remove or disinfect the hazard. Dry wiping can spread contamination and does not disinfect the surface. Patients should not be involved in hazardous cleanup. Question 6. When a patient encounter unfolds in a medication administration visit, a subpoena for medical records arrives at the office. Which response is best? Option A. Immediately fax the entire chart without review. Option B. Give it to the provider or designated privacy officer for proper handling. Option C. Ask the receptionist to summarize the chart from memory. Option D. Ignore it because subpoenas never apply to clinics. The correct answer is option B. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Records should not be released without verifying legal requirements and scope. Summaries from memory are unreliable and not an appropriate legal response. Subpoenas can require action and should not be ignored. Question 7. Following office protocol in an infection control audit, a patient makes a complaint about care received in the office. Which response is most professional? Option A. Post the complaint online for staff opinions. Option B. Delete documentation related to the complaint. Option C. Argue until the patient stops complaining. Option D. Listen respectfully and follow the office complaint process. The correct answer is option D. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Destroying or altering records is unethical and may be illegal. Arguing escalates conflict and is unprofessional. Question 8. The care team in an exam room asks for guidance because an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Patient autonomy. Option B. Beneficence. Option C. Abandonment. Option D. Respondeat superior. The correct answer is option A. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Beneficence means acting for the patient's good but does not override a competent refusal. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Question 9. During a cardiology practice, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Airborne precautions. Option B. Reverse isolation for staff protection only. Option C. Droplet precautions only. Option D. Contact precautions only. The correct answer is option A. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Droplet precautions do not address smaller airborne particles that can remain suspended. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Question 10. For a patient encounter in a women's health clinic, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A. HIPAA. Option B. ARICE. Option C. PASS. Option D. PERLA. The correct answer is option C. PASS. PASS stands for pull, aim, squeeze, and sweep. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. PERLA describes pupil assessment. Question 11. When a patient encounter unfolds in a certification exam scenario, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Deny the request because there is no job-related need to know. Option B. Share the chart because staff work in the same clinic. Option C. Open the chart if the coworker promises not to tell anyone. Option D. Print the chart and remove the patient's name only. The correct answer is option A. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. Employment at the same clinic does not automatically authorize chart access. A promise does not create a permitted reason for access. De-identified information must meet specific standards and curiosity is not permitted access. Question 12. An office review in a treatment room shows that the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A. Reflex hammer. Option B. Centrifuge. Option C. Ophthalmoscope. Option D. Otoscope. The correct answer is option C. Ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A reflex hammer tests reflexes and does not visualize the retina. A centrifuge separates specimen components and is not an eye exam tool. An otoscope is used for the ear canal and tympanic membrane. Question 13. For a patient encounter in a same-day appointment, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The test shocks every patient to start the heart. Option B. The machine draws blood through the wires. Option C. The electrodes inject medication. Option D. The test records electrical activity and does not deliver a shock. The correct answer is option D. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. A standard electrocardiogram does not deliver electrical therapy. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. Question 14. The care team in a cardiology practice asks for guidance because a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the assistant's initials with no service information. Option B. Only the room number. Option C. Only the patient's favorite color. Option D. Procedure code and diagnosis or reason for the service. The correct answer is option D. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Initials alone do not provide billing codes or medical necessity. Room numbers do not describe the service or diagnosis. Personal preferences do not support claim coding. Question 15. Before the visit continues in a medication administration visit, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A. Insurance remittance advice. Option B. Patient intake form. Option C. The appointment reminder template. Option D. Safety data sheet. The correct answer is option D. Safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Reminder templates do not address workplace chemical safety. Question 16. Before the visit continues in an urgent care office, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A. Oxygen saturation and pain score. Option B. Height and weight. Option C. Blood pressure and temperature. Option D. Pulse and respirations. The correct answer is option B. Height and weight. Body mass index is calculated from height and weight. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Question 17. While working in a medication administration visit, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Keep a diary of symptoms and activities as instructed. Option B. Submerge the monitor in water. Option C. Remove electrodes whenever symptoms occur. Option D. Ignore the return time. The correct answer is option A. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Water can damage the device and create safety risks. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Question 18. After reviewing the situation in a primary care office, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A. Use a qualified medical interpreter. Option B. Speak louder and slower in English only. Option C. Skip the explanation if the patient nods. Option D. Ask a young child to interpret. The correct answer is option A. Use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Volume does not remove a language barrier. Nodding does not prove understanding or valid communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Question 19. To protect safety in a walk-in clinic, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Document that the patient requested it and proceed. Option B. Perform it because any provider request is automatically legal. Option C. Ask another assistant to do it secretly. Option D. Clarify the concern and follow legal scope of practice requirements. The correct answer is option D. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Question 20. As part of exam preparation in a patient intake station, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Sit upright and lean slightly forward. Option B. Tilt the head far backward. Option C. Pack the nose with contaminated gauze. Option D. Lie flat immediately without assessment. The correct answer is option A. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood, while upright posture can reduce pressure. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 21. For a patient encounter in a patient education session, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Diagnose the patient based on abnormal values. Option B. Post the result publicly so others can comment. Option C. Change the results so it appears normal. Option D. Tell the patient the provider will review and explain the results. The correct answer is option D. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Diagnosis is outside the medical assistant scope of practice. Public disclosure violates confidentiality and professionalism. Changing results is unethical and falsifies the record. Question 22. As part of exam preparation in an electronic health record review, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A. Discard the result because it is abnormal. Option B. Notify the provider or designated clinical staff promptly. Option C. Tell the patient the exact diagnosis without provider review. Option D. File the result for review at the end of the month. The correct answer is option B. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Delaying a critical result can put the patient at risk. Question 23. As part of exam preparation in a certification exam scenario, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Around. Option B. Between. Option C. Below normal. Option D. Above normal or excessive. The correct answer is option D. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Around is indicated by peri. Between is indicated by inter. Below normal is indicated by hypo. Question 24. Following office protocol in an exam room, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Use the appointment time as the identifier. Option B. Correct the date of birth without asking anyone. Option C. Stop and resolve the discrepancy before proceeding with care. Option D. Continue if the last name matches. The correct answer is option C. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. Changing demographic data without verification may create a documentation error. A last name alone does not rule out an identity error. Question 25. In a specialty referral visit, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B. Gloves completely replace hand hygiene. Option C. Hand washing is needed only before eating. Option D. Alcohol sanitizer is always illegal in clinics. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Gloves reduce exposure but do not replace hand hygiene after removal. Hand hygiene is required at multiple points in patient care. Alcohol-based hand rubs are appropriate for many routine situations. Question 26. To protect safety in a specialty referral visit, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Eat a heavy meal immediately before every test. Option B. Ignore all provider instructions about inhalers. Option C. Wear tight clothing that restricts breathing. Option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. The correct answer is option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. A heavy meal may interfere with comfortable breathing for some tests. Medication instructions should follow the provider or testing protocol. Restrictive clothing can interfere with respiratory effort. Question 27. As part of exam preparation in a walk-in clinic, a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A. Document the symptoms and tell the patient the provider will evaluate them. Option B. Tell the patient to search the internet for a diagnosis. Option C. Ignore the symptoms because they are subjective. Option D. Give a diagnosis to save time. The correct answer is option A. Document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Unguided self-diagnosis can be inaccurate and unsafe. Reported symptoms are relevant and should be documented. Diagnosing is outside the medical assistant scope. Question 28. After reviewing the situation in a phlebotomy station, the suffix itis appears in a medical term. Which meaning is most accurate? Option A. Pain. Option B. Inflammation. Option C. Removal. Option D. Study of. The correct answer is option B. Inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Question 29. Given the workflow in a medical office workflow, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Leave the patient standing while searching for forms. Option B. Tell the patient dizziness is impossible. Option C. Assist the patient to sit or lie down safely. Option D. Ask the patient to walk faster. The correct answer is option C. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. Question 30. During an infection control audit, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Leave the tube unmixed until pickup. Option B. Gently invert the tube the required number of times. Option C. Shake the tube forcefully. Option D. Open the tube and stir with a swab. The correct answer is option B. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Question 31. An office review in an infection control audit shows that a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Ignore the band if the patient seems healthy. Option B. Give medication first and ask about allergies later. Option C. Verify the allergy information in the record and with the patient. Option D. Remove the band so it does not worry the patient. The correct answer is option C. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergy risk is not based on appearance. Allergies must be checked before administration. Removing an alert without direction can create risk. Question 32. At the start of care in a medication administration visit, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Ask the patient to remember only prescription allergies. Option B. Place the form in the chart without reviewing it. Option C. Verify the allergy information and enter it clearly in the medical record. Option D. Remove allergies that the patient says happened many years ago. The correct answer is option C. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Allergies to over-the-counter drugs, foods, or latex may also affect care. Important safety information can be missed if the history is not reviewed. Past reactions may still be clinically important and should not be deleted without provider direction. Question 33. Before the visit continues in a diagnostic testing area, an electronic record uses an audit trail. What is its purpose? Option A, approve insurance claims instantly. Option B, sterilize instruments automatically. Option C, track who accessed or changed information. Option D, measure blood pressure. The correct answer is option C, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Payer claims processing is separate from record audit logs. Audit trails do not process instruments. Vital sign measurement requires clinical equipment and technique. Question 34. Given the workflow in an urgent care office, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, a normal calibration mark only. Option B, a properly grounded machine with still patient. Option C, correct limb lead placement. Option D, poor electrode contact or patient movement. The correct answer is option D, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Question 35. An office review in a clinical skills review shows that the term nephrology appears in a referral. Which specialty is involved? Option A, kidneys. Option B, eyes. Option C, ears. Option D, bones. The correct answer is option A, kidneys. Nephrology is the specialty focused on kidney function and disease. Ophthalmology focuses on eyes. Otolaryngology focuses on ear, nose, and throat conditions. Orthopedics focuses on the musculoskeletal system. Question 36. During a patient intake station, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, into an area that is bruised and inflamed. Option B, abdomen with adequate subcutaneous tissue. Option C, deep into the deltoid muscle only. Option D, directly into a vein. The correct answer is option B, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Bruised or inflamed tissue should generally be avoided. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Intravenous administration is a different route and is outside a subcutaneous injection. Question 37. Before the visit continues in a telephone triage workflow, the term gastroenterology appears in a referral. Which specialty is involved? Option A, digestive system. Option B, nervous system. Option C, urinary bladder only. Option D, endocrine glands. The correct answer is option A, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Neurology focuses on the nervous system. Urology focuses on the urinary tract and male reproductive system. Endocrinology focuses on hormone-producing glands. Question 38. While working in a clinical skills review, a patient has an advance directive in the chart. Which statement is most accurate? Option A, it is used only to schedule appointments. Option B, it communicates the patient's wishes about future medical care. Option C, it allows the assistant to ignore provider orders. Option D, it replaces all insurance forms. The correct answer is option B, it communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Scheduling is unrelated to the purpose of an advance directive. Care decisions still follow legal, clinical, and facility processes. Advance directives do not replace billing or insurance documents. Question 39. While working in an administrative check-in area, the provider discusses the function of white blood cells. Which role is most accurate? Option A, produce insulin in the pancreas. Option B, store bile for digestion. Option C, carry oxygen as their primary job. Option D, help defend against infection. The correct answer is option D, help defend against infection. White blood cells are immune cells that help protect the body from infection. Insulin production occurs in pancreatic beta cells, not white blood cells. Bile storage is a gallbladder function. Oxygen transport is mainly the role of red blood cells. Question 40. For a patient encounter in an administrative check-in area, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Label the empty tube as collected. Option B. Gently adjust the needle position while maintaining safety. Option C. Probe aggressively until blood returns. Option D. Remove the tourniquet and continue filling all tubes. The correct answer is option B. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. A tube without the required specimen must not be labeled as completed. Excessive probing can injure tissue and increase patient discomfort. Without blood flow, the collection cannot continue effectively. Question 41. In an internal medicine office, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Midway between V2 and V4. Option B. 5th intercostal space at the left midclavicular line. Option C. 4th intercostal space at the right sternal border. Option D. 4th intercostal space at the left sternal border. The correct answer is option B. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V1. That location is used for V2. Question 42. An office review in a family practice clinic shows that a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A. Prone position. Option B. Trendelenburg is the only routine choice. Option C. Lithotomy position. Option D. Fowler position. The correct answer is option D. Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Lithotomy is used for pelvic procedures and does not primarily support breathing. Question 43. To protect safety in a specialty referral visit, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. Every morning. Option B. Immediately. Option C. As needed. Option D. By mouth. The correct answer is option C. As needed. PRN means the medication is taken as needed according to the order. Every morning is commonly abbreviated differently and is not PRN. Immediately is STAT in common medical usage. By mouth is PA. Question 44. During a medical office workflow, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A. Subcut. Option B. IM. Option C. 4. Option D. PA. The correct answer is option D. PA. PA means by mouth and is used for oral administration. Subcut means subcutaneous and refers to injection into tissue under the skin. IM means intramuscular and refers to injection into muscle. 4 means intravenous and refers to administration into a vein. Question 45. The care team in a quality control review asks for guidance because a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Use the instruments if the package is dry. Option B. Open the package and rinse the instruments. Option C. Write a new date on the package. Option D. Reprocess the instruments before use. The correct answer is option D. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. Question 46. An office review in a specialty referral visit shows that the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Use it after expiration if it looks clear. Option B. Place it in direct sunlight to warm quickly. Option C. Store it in a desk drawer overnight. Option D. Maintain required temperature storage and check expiration before use. The correct answer is option D. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Room temperature storage can damage refrigerated products. Question 47. When a patient encounter unfolds in a phlebotomy station, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, routine scheduling. Option B, quality control testing. Option C, appropriate marketing. Option D, breach of confidentiality. The correct answer is option D, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Scheduling does not involve posting private health information publicly. Quality control relates to test system accuracy, not social media disclosure. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Question 48. At the start of care in a community health clinic, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, demographics, contact information, insurance information, and reason for visit. Option B, the assistant's diagnosis before the visit. Option C, another patient's insurance card. Option D, only the patient's favorite pharmacy color. The correct answer is option A, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. Insurance information must belong to the patient being registered. That information does not complete registration. Question 49. To protect safety in a community health clinic, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, ask the patient to jump to the table. Option B, leave the wheelchair unlocked for easier movement. Option C, lock the wheelchair and use proper body mechanics with assistance as needed. Option D, pull the patient by the arms quickly. The correct answer is option C, lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Question 50. In a certification exam scenario, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A, the temperature will be elevated. Option B, the blood pressure may read falsely high. Option C, the pulse oximetry reading will be inaccurate. Option D, the blood pressure may read falsely low. The correct answer is option B, the blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size has no direct effect on body temperature. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Question 51. For a patient encounter in a quality control review, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, send it to a number from memory without checking. Option B, include unrelated patient charts in the same fax. Option C, leave the fax confirmation on a public counter. Option D, verify the recipient fax number before sending. The correct answer is option D, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Memory errors can lead to misdirected protected information. Only necessary information should be disclosed. Confirmation pages may contain protected information and should be handled securely. Question 52. In a women's health clinic, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, leave it because both patients use the same clinic. Option B, delete the form and tell no one. Option C, ask the patient to sign a blank form. Option D, report and correct the filing error according to policy. The correct answer is option D, report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Blank forms do not correct the misfiled record and are inappropriate. Question 53. Given the workflow in a preventive care visit, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, coordination of benefits. Option B, defamation. Option C, emancipation. Option D, battery. The correct answer is option D, battery. Battery can involve intentional touching or treatment without consent. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Emancipation relates to a minor's legal independence. Question 54. At the start of care in a family practice clinic, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, wait for the provider before starting any response. Option B, begin CPR and use the automated external defibrillator as directed. Option C, use the defibrillator on a conscious patient asking questions. Option D, give oral medication before checking responsiveness. The correct answer is option B, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Oral medication is unsafe when cardiac arrest is suspected. Question 55. When a patient encounter unfolds in a treatment room, a chain of custody urine drug screen is collected. Which practice is most important? Option A, skip signatures if the specimen looks normal. Option B, document each transfer and maintain specimen integrity. Option C, allow the patient to take the specimen home first. Option D, use an unlabeled container until the lab receives it. The correct answer is option B, document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Unlabeled specimens can be rejected and cannot be reliably traced. Question 56. After reviewing the situation in a family practice clinic, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A, sterile field setup. Option B, matrix blocking. Option C, order of draw. Option D, coinsurance posting. The correct answer is option B, matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Sterile field setup supports clinical procedures, not schedule blocking. Order of draw guides blood collection sequence. Coinsurance posting relates to patient financial responsibility. Question 57. During a busy front office, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, assault. Option B, beneficence. Option C, coinsurance. Option D, abandonment. The correct answer is option D, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Beneficence means acting for the patient's good. Coinsurance is a payment-sharing insurance term. Question 58. The care team in a primary care office asks for guidance because the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, use gloves and dispose of the dressing according to biohazard policy. Option B, handle the dressing with bare hands. Option C, save the dressing in the patient's purse. Option D, place the dressing on the clean supply tray. The correct answer is option A, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Soiled material can contaminate clean supplies. Question 59. An office review in a walk-in clinic shows that the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, open hours. Option B, double booking. Option C, clustering. Option D, wave scheduling. The correct answer is option B, double booking. Double booking places more than one patient in the same appointment slot. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Wave scheduling schedules several patients to arrive at the beginning of a block. Question 60. At the start of care in a procedure setup, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the right sternal border. Option B, left arm below the clavicle. Option C, fifth intercostal space at the left midclavicular line. Option D, a fourth intercostal space at the left sternal border. The correct answer is option A, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. That location corresponds to V2. Question 61. For a patient encounter in a specialty referral visit, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, ophthalmic. Option B, otic. Option C, topical. Option D, sublingual. The correct answer is option D, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Otic medications are placed in the ear. Topical medications are applied to the skin or surface tissues. Question 62. While working in a family practice clinic, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, refuse all care without considering exceptions. Option B, follow state law and office policy for consent requirements. Option C, assume all minors can consent to every service. Option D, ask another patient in the waiting room to consent. The correct answer is option B, follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Question 63. Following office protocol in an electronic health record review, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, green tube. Option B, gray tube. Option C, lavender tube. Option D, light blue tube. The correct answer is option A, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Gray tubes are often used for glucose-related testing depending on protocol. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Question 64. For a patient encounter in an internal medicine office, a patient feels faint during a blood draw. Which response should occur first? Option A, stop the procedure and protect the patient from injury. Option B, tell the patient to stand up quickly. Option C, leave the patient alone to find paperwork. Option D, finish filling the tube before responding. The correct answer is option A, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. Standing can worsen faintness and lead to a fall. A faint patient should not be left unattended. Continuing the draw can worsen the situation and increase injury risk. Question 65. As part of exam preparation in a certification exam scenario, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A, tell the patient to stop immediately. Option B, recommend doubling the dose instead. Option C, refer the question to the provider. Option D, suggest using a friend's medication. The correct answer is option C, refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Directing medication discontinuation is outside the assistant role. Changing a dose without provider order is unsafe and outside scope. Sharing medication is unsafe and inappropriate. Question 66. Before the visit continues in an administrative check-in area, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A, ignore the symptoms if the injection site looks clean. Option B, tell the patient to drive home and rest. Option C, schedule a routine follow-up for next week. Option D, notify the provider and activate emergency protocol immediately. The correct answer is option D, notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Systemic allergic symptoms matter even if the injection site appears normal. Respiratory symptoms and swelling require immediate attention. Potential anaphylaxis cannot be delayed for routine follow-up. Question 67. Given the workflow in an electronic health record review, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A, informed consent. Option B, implied consent. Option C, battery. Option D, abandonment. The correct answer is option A, informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Implied consent is inferred from actions such as extending an arm for a blood draw. Battery involves unauthorized touching or treatment. Abandonment involves ending care without appropriate notice. Question 68. Following office protocol in a women's health clinic, a patient falls in the exam room. Which action is best? Option A, tell the patient to drive home without evaluation. Option B, hide the incident if no one saw it. Option C, pull the patient up immediately. Option D, call for help and assess for injury before moving the patient. The correct answer is option D, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. The patient should be assessed before leaving. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. Question 69. Given the workflow in an administrative check-in area, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, lock the workstation before stepping away. Option B, keep the screen facing the waiting room. Option C, disable audit trails to speed workflow. Option D, share passwords with trusted co-workers. The correct answer is option A, lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Visible screens increase privacy risk. Audit trails support security monitoring and should not be disabled by staff. Shared passwords weaken accountability and violate security practices. Question 70. At the start of care in a specialty referral visit, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, patient reports sharp right ear pain for 2 days. Option B, ear infection diagnosed today. Option C, patient seems dramatic about ear pain. Option D, right ear normal after exam. The correct answer is option A, patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. A diagnosis should not be documented by the assistant unless the provider has made it. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint. Question 71. To protect safety in a pediatric clinic, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, lavender EDTA tube for serum. Option B, a red or gold serum tube. Option C, gray fluoride tube for all serum tests. Option D, light blue citrate tube for serum. The correct answer is option B, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Gray tubes are not the standard serum tube for routine chemistry panels. Citrate anticoagulant is used for coagulation testing. Question 72. When a patient encounter unfolds in a diagnostic testing area, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, administer the medication because it was ordered. Option B, change the medication to another drug independently. Option C, ask the patient to sign a form and give it anyway. Option D, hold the medication and notify the provider. The correct answer is option D, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. Question 73. Given the workflow in a preventive care visit, a complete blood count is ordered. Which tube is most commonly used? Option A, lavender tube with EDTA. Option B, gray tube with fluoride oxalate. Option C, light blue tube with sodium citrate. Option D, a red tube with no anticoagulant. The correct answer is option A, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Gray tubes are used for tests such as glucose or lactate depending on protocol. Sodium citrate is used mainly for coagulation studies. A red tube allows clotting and is not the standard choice for a complete blood count. Question 74. At the start of care in a pediatric clinic, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, melatonin. Option B, insulin. Option C, estrogen. Option D, thyroxine. The correct answer is option B, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Thyroxine is a thyroid hormone involved in metabolism. Question 75. A medical assistant is working in a certification exam scenario when a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, place electrodes over clothing. Option B, ignore loose electrodes if the tracing prints. Option C, wet the electrodes with tap water only. Option D, prepare the skin according to protocol to improve electrode contact. The correct answer is option D, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Electrodes must contact skin to record electrical activity. Loose electrodes can create artifact and poor quality results. Unapproved moisture does not replace proper skin preparation. Question 76. An office review in an electronic health record review shows that a staff member shares an electronic health record password to save time. Which risk is created? Option A, loss of accountability for chart access. Option B, improved privacy protection. Option C, better sterilization monitoring. Option D, automatic insurance approval. The correct answer is option A, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Password sharing weakens privacy and security. Login credentials do not sterilize instruments. Passwords do not control payer authorization. Question 77. During an administrative check-in area, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, delete sensitive information before the request is reviewed. Option B, refuse because records belong only to the provider. Option C, give the record to anyone who asks. Option D, follow the office release of information process. The correct answer is option D, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Question 78. At the start of care in a diagnostic testing area, the term hypertension appears in the problem list. Which meaning is correct? Option A, high blood pressure. Option B, low blood glucose. Option C, joint inflammation. Option D is slow breathing. The correct answer is option A, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Low blood glucose is hypoglycemia. Joint inflammation is arthritis. Slow breathing is bradypnea. Question 79. Before the visit continues in a diagnostic testing area, a pelvic examination is scheduled. Which patient position is commonly used? Option A, prone. Option B, lithotomy. Option C, Sims. Option D, Trendelenburg. The correct answer is option B, lithotomy. The lithotomy position is commonly used for pelvic examinations. Prone means lying face down and is not the common pelvic exam position. Sims position is often used for rectal procedures or enemas. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Question 80. For a patient encounter in an exam room, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A, spleen. Option B, appendix. Option C, kidney. Option D, gallbladder. The correct answer is option C, kidney. The kidneys filter blood, regulate fluid balance, and form urine. The spleen filters blood cells and supports immune function but does not form urine. The appendix is associated with lymphoid tissue in the digestive tract. The gallbladder stores bile and does not form urine. Question 81. To protect safety in an internal medicine office, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, skip the pulse and record not available. Option B, count the pulse for a full 60 seconds. Option C, count for 10 seconds and multiply by 6. Option D, use the patient's previous pulse from the chart. The correct answer is option B, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. The findings should be measured and reported rather than skipped. Short counts are less reliable when the rhythm is irregular. Old values do not represent the current clinical status. Question 82. While working in a clinical skills review, a pregnancy test performed in the office is classified as wave testing. Which requirement still applies? Option A, report results before the test develops. Option B, use expired kits if the package is unopened. Option C, skip controls because waived means unregulated. Option D, follow manufacturer instructions and quality control policy. The correct answer is option D, follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Reading before the correct time can produce inaccurate results. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Question 83. In a clinical skills review, an intradermal test is being prepared. Which description matches the route? Option A, injection into deep muscle tissue. Option B, injection just under the epidermis to form a small wheal. Option C, medication placed into the ear canal. Option D, medication swallowed by mouth. The correct answer is option B, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Ear canal administration is otic. Swallowed medication is oral administration. Question 84. A medical assistant is working in a community health clinic when the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, against. Option B, below normal or deficient. Option C, above normal. Option D, before. The correct answer is option B, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Against is indicated by anti. Above normal is indicated by hyper. Before is indicated by pre. Question 85. Following office protocol in a primary care office, a patient asks which body system includes the skin. Which system should be identified? Option A, endocrine system. Option B, respiratory system. Option C, integumentary system. Option D, urinary system. The correct answer is option C, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The endocrine system is made of hormone-producing glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. Question 86. While working in an internal medicine office, a prothrombin time test is ordered. Which tube should be selected? Option A, blood culture bottle only. Option B, gray tube. Option C, light blue tube. Option D, lavender tube. The correct answer is option C, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Blood cultures detect microorganisms and are not used for prothrombin time testing. Gray fluorite oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Question 87. At the start of care in a cardiology practice, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, use tape only and skip electrodes. Option B, move all chest leads to the abdomen. Option C. Apply electrodes directly over lotion. Option D. Clean and dry the skin before applying electrodes. The correct answer is option D. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Tape cannot record cardiac electrical activity. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Question 88. A medical assistant is working in a community health clinic when a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Promise that the provider will not be concerned. Option B. Tell the patient the reading is probably wrong. Option C. Ignore the anxiety to avoid making it worse. Option D. Acknowledge the concern and explain the procedure in simple terms. The correct answer is option D. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Question 89. Following office protocol in a medical office workflow, the term otitis media is listed in the assessment. Which body area is involved? Option A. Kidney. Option B. Middle ear. Option C. Liver. Option D. Stomach. The correct answer is option B. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Kidney inflammation is related to nephritis or pyelonephritis. Liver inflammation is hepatitis. Stomach inflammation is gastritis. Question 90. While working in a procedure setup, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Wash the area and report the exposure according to protocol. Option B. Place a bandage on the site and ignore it. Option C. Finish all remaining patients before telling anyone. Option D. Hide the incident if there is no bleeding. The correct answer is option A. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Covering the wound alone does not address exposure risk. Delaying reporting can delay needed evaluation and follow-up. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 91. Before the visit continues in a women's health clinic, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A. Pulmonary vein. Option B. Superior vena cava. Option C. Pulmonary artery. Option D. Aorta. The correct answer is option C. Pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. Pulmonary veins return oxygenated blood from the lungs to the left atrium. The superior vena cava returns venous blood to the right atrium. The aorta carries oxygenated blood from the left ventricle to the body. Question 92. To protect safety in an infection control audit, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Blow on the site to speed drying. Option B. Allow the alcohol to dry completely. Option C. Draw blood while alcohol is still wet. Option D. Touch the vein again with an ungloved finger. The correct answer is option B. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Wet alcohol can sting and may affect specimen quality. Palpating after cleaning can contaminate the site unless proper technique is used. Question 93. During a primary care office, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A. Release it and allow the arm to recover before continuing. Option B. Move it over the venipuncture site. Option C. Tighten it further until the vein bulges. Option D. Ignore the time because tourniquets do not affect tests. The correct answer is option A. Release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. Question 94. Before the visit continues in a cardiology practice, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A, patient is definitely exaggerating the cough. Option B, patient states, I have had a cough for 3 days. Option C, no documentation is needed for symptoms. Option D, the assistant diagnoses pneumonia. The correct answer is option B. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Judgmental wording is inappropriate and not objective. Symptoms are relevant to the visit and should be documented according to policy. Diagnosis belongs to the provider. Question 95. For a patient encounter in a quality control review, a reagent bottle is past its expiration date. Which action is appropriate? Option A, change the expiration date on the label. Option B, do not use it for patient testing. Option C, use it only for abnormal patients. Option D, mix it with a new reagent to strengthen it. The correct answer is option B, do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Altering dates is unsafe and unethical. Expired reagents are not reliable for any patient testing. Mixing reagents without approval can invalidate testing. Question 96. A medical assistant is working in a telephone triage workflow when office supplies are consistently running out before the next order date. Which administrative action is best? Option A, hide supplies from the provider. Option B, track usage and adjust par levels according to office needs. Option C, order random supplies without reviewing use. Option D, wait until every item is completely gone. The correct answer is option B. Track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Hiding supplies does not solve inventory management. Unplanned ordering can waste money and storage space. Waiting can interrupt patient care and office workflow. Question 97. Before the visit continues in a telephone triage workflow, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, venipuncture. Option B, auscultation. Option C, autoclaving. Option D, prior authorization or referral process. The correct answer is option D, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Autoclaving sterilizes instruments and is unrelated to payer approval. Question 98. When a patient encounter unfolds in a same-day appointment, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, ask the patient to drive to another clinic. Option B, complete all paperwork before telling anyone. Option C, tell the patient it is probably anxiety. Option D, notify the provider immediately and follow emergency protocol. The correct answer is option D, notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Potential cardiac symptoms should be handled through established emergency procedures. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Question 99. When a patient encounter unfolds in an internal medicine office, a patient wants information released to a spouse. Which documentation is usually needed? Option A, a verbal request from the spouse only. Option B, no documentation because spouses always have full access. Option C, a note written by the assistant after the fact. Option D, a valid authorization or permission according to office policy. The correct answer is option D, a valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. The spouse's request alone may not authorize release. Relationship alone does not automatically grant full access to records. Authorization should come from the patient or legal authority. Question 100. The care team in a same-day appointment asks for guidance because a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A, sterile technique. Option B, patient confidentiality. Option C, chain of custody. Option D, prior authorization. The correct answer is option B, patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Sterile technique concerns preventing contamination during procedures. Chain of custody concerns specimen handling documentation, not public conversations. Prior authorization concerns payer approval for services.